order. We want to just start with introductions. I'll start with myself. I'm Liz Farrar from Gilliam County.
Rob Orgley, Wheeler County.
Joe Bolskis, Sherman County.
Leslie Weatherall, Gilliam County. I'm Teri Thalhofer, I'm Director of North Central Public Health District, serving Gilliam, Sherman, and Wasco counties.
Lynn Morley, Wheeler County.
Sherry Wilkins, Gilliam County.
Rick Schaefer, Wheeler County.
Joni Bird, Sherman County.
Tom McCoy, Sherman County.
Mary Dyer, Gilliam County.
And then do we want to do the audience real quick?
So you can see.
Oh, okay, Kelly Smith, Gilliam County. Catherine Groner, City of Condon.
She's used
Jean
to that.
Bolskis.
She likes to look
Steve
at
Schaefer.
their backs, yeah.
You're it?
Kathleen Kathy. Senator Wyden.
Yeah, Senator Wyden, sorry.
Okay, any additions, revisions to the agenda? Nothing. Former Commissioner, Gilliam County Commissioner Mike Weimer called this morning and said that there's a position open on the CAPCO board. I think it's a Gilliam Wheeler.
It's, yeah, and I sent Melissa Lindsay an email the other day, I haven't heard back from her yet.
Okay, about an opening.
Yeah.
Okay, so maybe we'll just do that offline since it's the two counties that are deciding that. Okay, then we'll go right into 3.0, which is public health modernization. Go ahead, Teri.
Thank you. So Commissioner Bird and Commissioner Weatherall are the representatives to the North Central Public Health District Governance Board, and asked me to present a little bit about public health modernization, what's been happening the last 2 years, and where we're going forward. So if you have questions along the way, stop and ask. So several years ago, Oregon started talking about what a modernized public health system would look like for Oregonians, and agreed that the things in the red box should be available to all Oregonians, and that's the foundational capabilities, which are assessment and epidemiology, emergency preparedness and response, communications, policy and planning, leadership and organizational competencies, health equity and cultural responsiveness, and community partnership development. And then there should be 4 program areas that are foundational to public health, and that would be communicable disease control, environmental health, both regulatory and non-regulatory, prevention and health promotion, and access to clinical preventative services. So that was agreed upon and adopted by the Oregon Health Authority and the coalition, the Conference of Local Health Officials. Oh, yes, and so here are the slides. Like to follow along. And then above the line would be additional programs that particular communities, counties, or regions would want to have that were above that foundational level. And there was an assessment done at the time that all local public health departments participated in, and the state, and found that no one had all of this in place. And it was, the assessment looked very much like a crazy quilt, and it wasn't the large counties that were closer to having it all, and the small counties that were furthest. It was a very wide mix. And in that assessment, it was determined that it would be about $48 million a biennium to get us to where we needed to be to achieve this across Oregon. So the legislature in the 17-18 session, is that right? 2 years ago, allocated $5 million to public health modernization of the $47 million ask. And that is the biggest investment Oregon has made in public health in years and years. Up to that point, Oregon was 47th out of the 50 states in public health investment at the state legislature, and the majority of public health investment either comes through federal pass-through dollars or county general fund. So, and the level of county general fund support is variable across states, from Morrow County, who has the most, to some counties that county general fund, there's no county general fund available for support. And it doesn't, it's very clear that it is not a lack of understanding for what public health can do for their communities, but some counties are just in the position that they're having to prioritize basic service and they're unable to prioritize public health over and above what comes through state general fund or federal dollars.
With Morrow County having more dollars from their general fund, does their program look better than?
They do have more capacity, but still, because they're a small county, for example, they don't do their environmental health. They contract with Umatilla County to do their environmental health. So there's still significant gaps. So there was an application process for that $5 million for regional initiatives that had to include more than one county. Well, they framed it local public health authority so that I wasn't eligible to apply by myself. That you had to take more than one county, and if there is a regional health equity coalition in your region, you had to get them to participate, and another non-governmental public health entity. And the application time was about 6 weeks. And there was a conversation at a CLO meeting about why, and they asked that we already had an existing relationship. So we decided that we would use Eastern Oregon CCO as our already existing relationship, because 2 of the 3 counties I represent are part of EOCCO. And then we also asked Hood River, and because I don't split my work between my counties for CCOs, we also asked Hood River to come along with us in this venture. So the partners in the Eastern Oregon Modernization Collaborative are North Central, which serves Gilliam, Sherman, and Wheeler, Hood River County, the Center for Human Development, which serves Union County, Umatilla Baker Grant, which is administered by Community Counseling Solutions, Harney, Malheur, Morrow, Lake, Wallowa, but we lost Wallowa County when they delegated their public health authority back to the state. Wheeler County is an adjunct member only because their letter didn't come in time to submit for the grant, and so they have all the opportunities and the benefits of the grant, but don't have the responsibilities in the MOU. Eastern Oregon CCO, Mid-Columbia Health Equity Advocates, which is at the Nextdoor Inc. And then we've added Yellow Hawk Tribal Clinic, which is at the Umatilla, the Confederated Tribes of the Umatilla Indian Reservation, and the Warm Springs Clinic. And the reason we added Warm Springs is, you may know, the majority of the property that's in the Warm Springs Reservation sits in Wasco County, although the majority of the population sits in Jefferson. So we brought them on board as well. So all of those partners came together, submitted a grant application to serve those counties in the region, and the chair is currently Carrie Brajati, who's the director at Union County, and a North Central Public Health District, because of our unique IGA status and the way the bylaws set up the board, is the fiscal agent, because we were able to move through the process quickly enough to be the fiscal agent. So what we said we would do is that we would increase regional coordination, capacity, and sustainability. We would support meaningful partner engagement, and we would identify and address regional health disparities. And so the objective, because we were asked to look at the areas of assessment and epidemiology, and lost it. Leadership and organizational competencies and health equity and health disparities. And one of the state's measures for public health modernization is improving gonorrhea rates, because in Oregon our gonorrhea rates have just kind of exploded. We decided our project would be to improve sexual and reproductive health in our region by reducing STI prevalence with an emphasis on gonorrhea, and STI is sexually transmitted infections. So we wanted to improve gonorrhea identification and treatment for all symptomatic and asymptomatic cases and partners through this modernized approach. We want to improve patient outcomes through promoting best practices, and we want to improve partner notification and treatment. So what we had found is, because medical providers weren't aware that our gonorrhea rates had gone up as much as they had, and gonorrhea had pretty much been kind of absent from our region for many years. I think in the first 10 years I worked at North Central, we had 1 case. Now we have 5 to 7 cases a year. And providers just weren't screening for it and weren't looking for it. And most clients are asymptomatic when they come in. So we needed to get the information out. So the activities we have done, we did passport to partner services and paid for 1 member from each health department to go there, and that was a CDC training on how to do STI investigations and client interviews. We've worked with our partners to bring some Oregon Health Authority case management training to the region. So that CDC-sponsored training and the OHA case management, we brought them into the region. We didn't ask people to travel to Portland. They were, we have found that Boardman and Hermiston tend to be the most central locations where people feel they can travel. And so we're bringing the trainers there so our partners don't have to travel to Bend or Portland or Salem. The Mountain West AIDS Education and Training Center we've sponsored provider-specific trainings on sexually transmitted infections and HIV for medical providers in the region. We've had targeted provider and public health detailing sessions about what their responsibilities are about reporting. And in La Grande, about a month ago, we held and sponsored the first Sexual Orientation and Gender Identification Summit, where people in the region were able to learn about the differences in gender identification and sexual orientation so that we could provide better care to those who identify that way. And what we find when we're looking at health disparities is people who do not identify as male, female, heterosexual tend to get less care and are sicker when they're identified. So we've done equity, inclusion, and diversity training across the region. Our staff supported each of the local health departments in doing a bar-high local self-assessment for addressing health inequities. We've provided local health department surge capacity. I'll just say Wheeler County at one point in this time got a strange disease that they'd never really dealt with. Rather than their staff having to spend hours figuring out what this was about, our staff, who that's all they do, was able to support them in that investigation, come out and do interviews, that sort of thing. And many of the counties have used that. Grant County has used that surge capacity. Baker County is using it right now. They have a staffing shortage. Umatilla County used it when they had a person gone. And for the first time, my staff at North Central, and we're probably one of the best supported and staffed around this, have been able to go on vacation without it causing a burden to the staff that's in-house, having to put something down to do that work. We've provided one-on-one support and training for local health department communicable disease staff. So the regional staff have gone into local health departments, worked with them on their communicable disease work. Local outreach in communities, working with partners like Yellowhawk and Warm Springs and Neon, which is in Umatilla County. Provided provider outreach, so there was a table at the Eastern Oregon CCO Clinicians Summit, and they've also worked with the clinical advisory panel of the Columbia Gorge CCO, and then fostering partnerships with key community organizations. And that takes a lot of work to get those partnerships up and running. So where are we going to go in the next biennium? So there was while we were waiting for the legislature to decide what kind of investment there was going to be, we submitted a 3-month work plan to OHA that was essentially, we're going to do work as we were doing it, but we did not have enough money to fully support the 3.5 staff that we have in the program. So Gobi agreed that if the funding didn't come through, that they would support the bridge funding because it directly supports their efforts in the region. I'll say Kevin, not Gobi, Kevin. So the legislature invested $15 million in this biennium. 10 million of those will go to local activities. So the distribution is currently being determined by the Conference of Local Health Officials and Oregon Health Authority. The The positions in the regional collaboratives that were truly regional will be funded. So our positions were truly regional. They did not work for North Central. They didn't add, to my staff. They were out in the region. Many of the counties hired their own staff in whatever, like the Clackamas, Multnomah, Washington, each of them hired a staff person. Well, those weren't truly regional, so those probably will not be funded through that. There has also been a funding formula that has been approved by the Public Health Advisory Board, so some dollars will go to every county. So it is they are thinking now that if you look at $7 million going to the local, and it's likely going to be less than that once they pay that 3-month bridge and that sort of thing, and then figure out how many regional positions are funded. Wheeler County would get $32,000 over the biennium. North Central would get $152,000 approximately over the biennium. And that's really not enough money to do much, especially when there will be new work. But in our region, if all the partners come together, it's about $900,000 in a biennium that we may be able to really do some good work with that if we decide to act regionally again.
So you're saying if all these people in the circle come together, it's 900,000?
Over 2 years. So, that's, $152,000 for me, that's not even a staff person over those 2 years. And I'm one of the better funded. Umatilla County, I think, gets $190,000 over the biennium. So it's really not enough to really do much work standing alone.
But that's 10 million more than they gave the last biennium, right? Is that right?
Yes.
So,
Yeah. We're going to be able to do good work with it, but I think that we're already discussing that coming together collaboratively will probably have more impact going forward. 1.2 million will go to tribal partners, so that will be federally recognized tribes and the group that serves urban tribal members in Portland. And tribes did not receive funding in the first iteration directly. Yellowhawk and Warm Springs did receive some support through our efforts, but they didn't receive any of their own funding. And then 3.8 million will stay at OHA to support the work we need OHA to do. So we have a modernization manual that sets out what the role of the state is, what the role of the locals is, and that money needs to stay at OHA for data systems and reporting and technical assistance and that sort of thing for us. So the efforts will continue around communicable disease control, health equity, and leadership capacity. There will be new efforts that will include work around public health emergency preparedness for environmental health risks, and that scope of work is currently being developed. The Eastern Oregon Modernization Partners would like to continue to work regionally on the current efforts, and the scope of work, once it comes out, will determine if and what other work could be done through cross-jurisdictional sharing. Environmental health and preparedness may not be best served by a 13-county regional approach. It may be smaller pockets that want to work together, and we'll just have to determine that. But we do not have to reapply for a grant, which, yay. I spent last summer writing that stupid thing and then made my husband drive it to Salem. So he actually offered. So if there are questions, we expect that the funding will be, the funding formula funding will come in our October amendment. They're trying to get it out the door pretty quickly.
So you're pleased with what the legislature did? You're pleased?
Yes.
with what-
Yes, I would have liked the 47 million, which was the ask, but the other thing about the 47 million, I'm not sure we have the workforce to ramp up that quickly. This is probably making more sense to do this over several biennia because we don't have the workforce to do it. We need to learn from each stage of growth as we move forward. We've been very vocal with the state that this is not a precursor to a 13 county regional health department, that is not what anyone is interested in, that where it makes sense, we will work collaboratively. Where it doesn't make sense, people need to have their own governance, and we need to be able to look to where smaller groups also, there may be different models for different activities.
So I wonder if I could, I don't know, make a comment or talk about something Ron's working on. Senator Grassley and Senator Wyden right now are working on an investigation into insulin costs. And they sent letters not long ago to 3 of the large pharmaceutical companies that manufacture insulin, requesting a lot of documents, internal emails, marketing materials, etc. And they sent 3 letters to the major pharmacy benefit managers. And so we recently had one of the finance staff and I did a couple meetings in Eastern Oregon to talk about the downstream effects of the high insulin pricing. And part of what we learned is that people are rationing their insulin and they're having unnecessary hospitalizations, and some folks are dying. And so that's even in our communities. And so as you're looking, and I don't know where it fits into the public health thing, but part of what we heard from folks was there were issues with food insecurity, there were issues with people maybe not having a stable home, and so it's really hard to manage your blood sugar and your diabetes and your medicine and your, people were, it was a more systemic problem than just, going to the doctor and getting your medicine and trying to stay on top of it. So as you're looking at the public health thing, just know we're interested in that, and we're interested in getting stories from folks in terms of how we consider it a crisis, how we consider this crisis is, affecting folks in rural Oregon. If you wouldn't mind. Thanks.
That's great. Any questions for Teri or comments?
That's when we do something good.
Not like she's busy.
You're a busy lady.
Well, I would just like to say thank you to all of you and those that were, elected officials during the last round. They didn't think we could do it. I mean, it was, we were very clearly kind of laughed at, that there was no way we were going to get all these counties to come together in this short amount of time. There was no way those of us in Eastern Oregon would be able to have great outcomes, and we are probably the most successful project. We've actually done the work regionally. We've had participation from all of the counties. County court and commission members were very supportive of us doing this work together and moved quickly through agendas to get the MOUs signed. And I'm just very proud of my Eastern Oregon partners that we got here, because they didn't think we would, and we did it. And so it's very exciting.
Love it.
Thank you.
Our partners on the west side have not been quite as successful or worked together quite as well. So what they don't understand is there's just like 13 of us just like get in a room together and we just hash it out, and it's not, we don't have to have all that bureaucracy around it. So we appreciate it.
Glad it works.
Yeah. Anything else? Should we move on?
Thank you for
Thanks
your
for
time.
being here.
Thank
Thank
you.
you for coming.
I have to wait for the computer to turn on so I can pull out my stuff.
Fine, it's nice and warm.
Is it nice? We got to do a little.
Somebody share that on
Just like musical chairs and see who gets that.
What I got out of this whole presentation is Wheeler County did something right
Yeah,
because
they
they
did.
get all the benefits and none of the responsibility. That's what I heard.
Good job.
Nothing wrong with that.
Good strategy. So should we move on to building codes update? Each of the four counties, will include Wasco County, met in Sherman County, 3 weeks ago now, 2 weeks ago? And we're each gonna take back, at the time it was an 80-10-10 split. We were all gonna take it back to our courts And so maybe it would be helpful for folks just to summarize what your court decided on that initial thing and any communication we've had back to Wasco County about our expectations or agreement or
Wheeler
counteroffers.
County Court decided just to go ahead and accept their offer and turn our building codes back over to the state.
Okay,
So the
And
the
I,
3%,
3.24%.
3.24%.
So if you go with the state, that doesn't do you any good. Are you gonna,
Well, yeah, I'm trying to figure out if the state just keeps that funding and it helps run our building codes.
I don't think it would benefit you if you stay with the state. I think that if you went with Morrow County or something, it would. Because then they would get it.
Is Morrow County in a position to take on any other counties right now? Because what I've been hearing, I'm not sure they're in a
Is-
position to take on any other counties.
Is it the city of Boardman or Morrow County?
the city of Boardman,
It's in I don't know if Morrow County has a,
they contract with the city.
they do the
Okay.
city, but, so.
That's kind of where we're at now, and I've got been trying to contact some folks down on the state, and I'm supposed to get a call in tomorrow to get everything straightened out, figured out just how this whole thing's gonna work. But that's where we're at right now.
So did you communicate that back to Commissioner
Also,
Kramer and,
yeah.
okay, and did they think that was acceptable, or have you heard anything back?
Yeah, I
from
said it
them?
was fine, as far as they knew. We haven't sent them an official letter, but I told them we'd get one out just as soon as I got everything lined out, so we knew exactly how things were gonna work out. So that's where we're at the moment.
Okay, so you guys are taking 3.4%.
Yeah, 3.24%, I think, was whatever, the original agreement.
From the state.
but if the state tells you that doesn't do you any good, will you still take it?
Well, what are we gonna do with it?
Well, you could leave it for the rest of us. And that's kind of what when we had our meeting, that was kind of what the idea was. I mean, if it could benefit Wheeler County, I think you ought to take it, but I'm not sure if you're gonna go with the state that it will. And I wonder, another question would be interesting is how long you could hold those reserves just in a bank account. I mean, could you hold them for 10 years and then if another better option came, I don't know.
I don't either, that's why
Yeah.
some things I'm trying to find out from the state here. But they're not the easiest folks to get a hold of.
And the state will give that answer in regards to those reserves, correct? Is that who the answer comes
Of
from?
whether the state would take the
Okay.
reserves, I think.
Yeah, I wanna
But then
find-
there's also the question of down the road, if the legislature allows us to do contractors directly. I mean, you guys may at some point want to just hold on to those funds if there's more flexibility down the road. I mean, they didn't address it this session, but that doesn't mean they won't try it
I
again
mean, you could run your own program by contracting.
through contracting.
Yeah, and since it's a
Yeah,
problem
money.
statewide, it may be something they take a serious look at.
So it might be worth, even if the state doesn't need it, it might be worth you guys holding on to it in
Well, that
case there is
was
flexibility down the
What we agreed
road.
on, I was, we just accept the funds, put a line item in our budget and just hold on to it and, another, something came up in the future, we can put that toward a building code program. I gotta find out and make sure that we can do this stuff, because my understanding of it is those can only go if it's electrical. If it was for electrical permits, that's all it could be used for. So I wanna get that all clear and just to make sure we
Well,
get
nobody knows, I
everything.
don't think, where that money in McCog's $4 million came from.
I don't think they tracked it, did
They
they?
didn't track it, so
Yeah.
I know
That could be.
Wayne Leash has been worried about that kind of issue, but I don't think there's any records that would tell you where it came from.
It's kind of-
If you learned anything, I wouldn't mind learning what you learned.
Okay. Long I can let you know.
Just if you learn anything, just, yeah, I'd like to know, so.
I called about a half a dozen times and finally, 8:30 this morning, I got a hold of somebody.
Well, I'm the same way. I called, let's see, I was talking to somebody, Don Bass is who I was finally, and it took 6 times to go back and forth, and then I'll get that information to you, and a week later, I was expecting it the following day, and a week later, well, we're not so sure.
Yeah, I got a kind of, well, this one's retired, so you'll need to catch up with this one, and there are
Yeah,
meetings all
yeah.
weekend, and get them to call you back.
Yeah, that's
what I
definitely, do the
did.
same thing, so.
Yeah, yeah.
Well, I sent, after our court, I sent a letter to Scott Hagee because we went over there and inspected their building codes program and talked about it. And I sent him, I said, today the Sherman County Court agreed on the earlier consensus of accepting 10% as Sherman County's share of the funds left in the Joint Building Codes Reserve Fund. We also would like Wasco County to put together an IGA outlining what the terms of joining Wasco County Building Codes program would be. The court would like to move forward with this. Service is our #1 concern, followed by the cost to our residents. And then Scott replied something, but they were kind of looking into it. So I don't know where his reply went.
Yeah, I think there's a lot more questions than answers still out there on this whole thing.
Yeah.
Well, they're just setting up their programs, so
So-
they don't really know what service levels will be and all that kind of thing, which is so important. I mean, you join Wasco County for only one reason. You're gonna pay more money in fees, I think, with them than you would at the state. So you only do it
For
if you're gonna
service.
get better service. And so really before you join Wasco County, you'd like some commitment that you'll get better service. And Wasco County doesn't seem to be willing to do that now. But it isn't, I'm not really blaming them, they're just trying to get the program, figuring out how it's gonna work.
Is that the same with the city of Boardman? They're just working on their duty.
So the city of Boardman has a long-standing one. The reason they're in transition is that their longtime inspector retired like 3-4 months ago. And so their new one came on, I think in late May. So when I spoke with Karen Pettigrew about potentially partnering with us, she just said that she wanted the new inspector to kind of get his feet wet a little bit more
Oh.
before she added or attempted to add one more demand onto him. So at the time, she had said probably late July, early August, she'd be ready to talk again. So I've got August 1st circled on my calendar to call her and see if they're willing to talk to us at that point.
That's almost exactly, I think, where Wasco County is. They don't want to commit to serving Sherman County or other counties till they know that they can serve their own county.
Exactly.
And they will once they've run the program for a while. Steve Crane was a little less enthusiastic about serving us than Scott Hagee had been. But I sympathize with
They
him.
all seem reluctant.
Yeah. But I think that mainly that it's just they don't know how it's going to work. And I must say, I was thinking about Tyler's argument, and I'm a little more sympathetic to it. I mean, I think what his argument is that when McCall in 2013, when I went on the McCall board, McCall had about $400,000 in reserves invested in their building. And so they were essentially out of free reserves. They had run through all the money generated by the wind farms, and they were down to about $400,000. And most of that $4 million that they had when they quit, when they disbanded in 2017, came from other sources, from Google and other revenue. So I don't think you can argue that it came from the wind farms. I mean, the wind farms certainly supported McCall in the 2008, 9, 7, 8, 9 period, but McCall had already blown through all those reserves in 2013.
Yeah, but then what that tells me is that the wind farms were supplementing Wasco County's permits during that period. I mean, I feel like we should still get credit for that, just because Wasco County blew through, I mean.
Well, it wasn't Wasco County, we all blew through it in the sense that we raised the fees by 20%
Right.
in order to balance the budget. So we had essentially charging too low of fees during the late, 2016, 17, and 18. They could do that because they had the wind farms.
Yeah.
But so we somewhat benefited from that too. It wasn't Wasco County exactly at that time.
Yeah, but I do feel like when you just pause in a moment in time and say, okay, well, we just put in most recently all the money, so we get to take it all back out, it discounts the partnership that occurred over a period of time. And the fact that our windmill developments carried that for a portion of time when there wasn't revenue, obviously that was coming in to otherwise support it. I mean, the building codes probably would have folded if our windmill companies hadn't been developing at the time, it sounds like. So I think my argument, and maybe the other Gilliam County folks can chime in too, is the argument that I'm trying to make is you have to look at the partnership over the whole period of time. And it's unfair to say, well, because we didn't charge enough in the early days and we blew through all of the reserves, you don't get any credit for having that money in there. To me is unfair to the smaller counties because we kept the doors open, basically. And so that's our position.
That is our position.
So our court had decided to send back a counteroffer to Wasco County. They have not responded to me at all, which was 15%, and then backing whatever your two courts came back with. So if you guys came back and wanted more, then we would back that. If you were happy with what, then we would back that. So, but I have not heard from Commissioner Kramer or Tyler or anybody in response to that. So I don't know what the next steps.
So you sent them a formal response?
I just sent them an email basically saying, you know, my court met, they instructed me to present a counteroffer of 15%. In addition, we'll support, you know, our understanding is that I think you guys had decided by then the 10%, and so I
Yes.
think my email said something to the effect of, we'll back Sherman County's 10%, and if Wheeler County asks for their 3%, we would support that as well, kind of thing. But I have not heard, and then in the email I said, if you want to come back to me with a counter proposal, maybe somewhere in between the 10 and 15, then please come back to us, and I have not heard back from them.
I read it.
Yeah.
And I actually tried to get a hold of Tyler Stone several times.
I got back, thanks Joe, I passed this request on to our staff and we'll work with them to consider it and respond as soon as possible. The next official meeting is August 7th. I'm hopeful we will be able to consider a decision at that point. Perhaps I can encourage our staff to begin working on appropriate documents, assuming we will move forward with the request. So I had positive feedback. Scott, so.
Maybe I need to go to Scott instead and see if he'll respond back.
And my feeling is from talking to him that Scott would like to have the other counties join with him, and Tyler and Steve are not anywhere near as enthusiastic. I'm trying to put that as nicely as I can. And I don't know where Kathy is. I don't talk to her about
I'm not sure. So any other updates? I guess we'll just keep each other informed. If anybody hears back from Wasco County, maybe have a plan to share with the other counties.
It sounds like August 7th, and they're going to be discussing it, correct? Sounds like according to your...
Yeah, that may be why we're not hearing
Yeah.
anything, is that they just need to
Are going to wait until then to discuss.
tell all of 3 of their commissioners can get together.
If I get any information from the state, I'll send you guys an email.
That would be great.
Yeah, that would be really
Thank
good.
you.
Yeah.
This is something we need to get settled. We
Yes.
can't sit on this. Wasco County needs reserves because they're starting to program up, so we need to get it settled one way or the other
Yeah.
fairly quickly, I think.
And we need to get help
I
to
think
our...
we're close. If Wasco County will just get back to us and confirm
Yea or nay?
their acceptance. Because it sounds like all 3 of us are in support of each other's requests, so.
We'll negotiate, but we have to have communication first.
Exactly. Okay, anything else on building codes? I will let you know as well about the city boardman, when I hear back from Karen
Yeah.
at the end of the month. And,
I heard the same thing, so I talked to her, and I knew you were all over it more than I was.
That's really another option for all 3
Yeah.
counties.
And that's what I think. I think we need to keep the doors open, especially if 2 of the commissioners are not, or one of the commissioners is not happy with Sherman County joining.
Well, yeah, and whether they're not happy or whether they're just so overwhelmed with getting the program up that they don't want to take on any extra commitments till they know that they can provide commitments to their own people. And that's a perfectly reasonable.
Yes, we just
stance.
want better service for our residents, all those.
We have to know that we're going to get better service
Yes.
or it's not worth joining.
Oh, yeah.
If the state can provide just as good a service, we'll get much lower fees from the state.
Just to let you guys know, when we had the meeting inspection with, on the building codes program, the last 5 years that Gilliam County, the average number of permits was 43 permits per year for the last 5 years. Sherman County was 47, Gilliam County was 43. But what was interesting is their data could be skewed because Wheeler County was identical
To us.
every year
Yeah.
to Gilliam County. So, I mean, one year it was 10 permits for both of you guys, and so it ended up being the 43. So that data could be skewed.
Do you have some secret building going on in Wheeler County then?
Oh, I'm sure there's not. They wouldn't do that.
Pretty hard to hide.
So anyway, under 50 permits for the last 5 years on average.
Because that was this question that Karen had was volume. And I had sort of indicated that, I mean, her concern was, you know, having to do like a stove inspection out in Lone Rock where it's like a $14 permit and the time to travel out there is so far. And so I had talked to her about us being open to grouping so that they kind of held that permit and then had one day when they came and did multiple inspections in Condon, but
So I just think of it as less than 1 week.
yeah.
So,
That's kind of like what Wasco County had said, just about the same thing.
yeah, so,
But she did say on our bigger projects, on our windmills, that would be as needed, she anticipated. So I would anticipate if they were partnering with you all, that if your big building projects where the fees can support it, that they would be much more on demand than.
Was the Montag project, for instance, getting good service from the state?
I have not heard of any complaints from them. If they're unhappy, they haven't brought them to me. So I don't know. I've not heard any problem on the permitting for them.
when we did our inspection, one of the things I asked him was, what is the hardest part about getting inspectors or setting up this program? It was getting inspectors. There's just nobody out there. Because in the back of your mind, you always think about, all right, if we're not getting service, maybe we need to step up. But then I also looked at what it was costing them, and they're averaging $90,000 a piece per inspector. So, I mean, some were higher than 100, some were lower than 90, but anyway, just ballpark looking over the shoulder at their figures, it was.
And then for our
Pretty
smaller
pretty
counties, being able to even recruit somebody to move here, and, yeah,
So,
it's tough. Okay, let's move on to fiber. I put it on there because it was on previously. I don't know if there's any developments. What's happening with yours in Sherman County? Didn't you guys have an RFP out and?
no, we accepted one, and we're don't start to go through our checklist, what we gotta do to get it happening,
Okay.
so.
But we've also got our towns almost all connected, all the homes in the towns connected to fiber.
But at
Fantastic.
end of August, I think Rufus will be done, is the last info we had, so.
Great.
Pretty lucky. Gordonsville's been a good partner for that so far, at least. I mean, Joni's hooked up to it, so.
It's great, yeah.
Love it.
Wonderful. But that's the city of Grass Valley is now, you know. They're getting quite a few people hooking up.
Are they more joining in?
Great.
It's kind of a no-brainer.
Oh, yeah.
Your telephone bill and
Yeah.
everything
And you
else.
consider
is
the
just
prices and
way,
everything.
way less.
And faster, yeah, so much faster. I don't know that I needed that.
You can always use more bandwidth.
Okay, all right.
I think so.
For Gilliam
Get used to
County,
it.
for Gilliam County's, Windwave just wrapped up the fiber build into Condon, and the project manager is doing the final inspection. We should have that report, I think, on Friday. And so that piece is rolling. So at least we'll have the main sort of backbone out of here. And then the city and the county are in discussions on doing sort of a joint management of our fiber pairs. And so once we kind of arrange what that agreement's gonna be, then we'll open it up to being able to sublease that out to local providers that wanna be ISPs in the region. So that's kind of pending at the moment. And other than that, the North End, our Arlington TV Co-op continues, I think, to kind of add people on one at a time. And then Columbia Basin is still looking at ways to deliver to their entire customer footprint. So I think they're still exploring how to do that and trying to find the federal money to be able to.
So they're still thinking about hooking all the farmers up to fiber?
Their board has directed Tommy Wolf to basically not necessarily be the ISP, but to facilitate fiber access to every customer within the co-op.
Rural too.
Rural too.
Wow.
Fiber to the barnyard.
Who is that?
Columbia Basin Electric. So now whether they end up doing that or it's cost prohibitive and they do some kind of hybrid of fiber to only certain places and then, wireless and other, I don't know where they'll end up, but they're still pursuing that, so.
The telephone company originally buried lines to all the rural, and all they'd have to do is upgrade those lines and hook them up to fiber and you'd have it done. So it isn't impossible.
Yeah.
It's just that they don't want to.
It's expensive.
How long have they been working on this?
They've been looking at it for about 2.5 years, probably.
Okay.
And they're just kind of creeping along.
Okay.
So I think their big sticking point is there really needs the Connect grant dollars, the USDA Connect America grant dollars. And I think if they could do that, then they would, it's funding is the issue. So if they can scrounge up enough grant dollars to do that, then I think they'll pursue that.
That's great.
Wheeler County's working with Gordonette. Gordonette's working with all three communities to set up, run fibers through all three communities and then shoot it into our wireless system to get it out. Start there. Gordonette seems to think it would work really well. So they're working with all the counties, all three cities to do that.
Good deal.
So on the fossil portion there, are they gonna hook into the Zayo line that's coming through that Columbia Basin spot into, or?
Well, we're still working on.
Working on saving
I see
that part.
Thalhofer's still pulling fiber out here in Canyon, so it's a long ways from being where it needs to be. But anyway, we're working with folks in there, and Gordonette's working with some folks, and of course the power companies are for access to the pole.
Yeah.
But your wireless system has a lot of capacity, doesn't it?
And there's a gig in each community.
Yeah.
There's plenty of capacity to run that and for the foreseeable future. Both of all three counties is what I know. It's a capacity. That's what we're working on now with working at.
Who would have thought 3 years ago? That 3 years ago we were talking about how we were never going to get fiber here, and now all three counties have it. It's amazing.
And we also got 2 solar traders. We got an employee one in latter part of September. It's on a 6-shooter ranch, but they don't want us in there just between the elk seasons, and so we got a 1-week window to get
Go around
it,
hunting
get it
season.
set up. We'll make a love of that.
You don't mess with the elk,
We don't
the elk
mess with that.
population.
And of course, fire season and stuff. So we got that scheduled. We'll put that one in there and see how it's going to work. It should provide at least 50 max there in household there. So
That's fantastic.
we're moving along. It's a work in progress, and it takes time. We'll get there.
Well, as soon as Sherman County gets their towns hooked up, then we'll try to upgrade the wireless system that serves the old Frontier Tillnet wireless system that serves the rural people. I mean, we think we have high-speed internet, but the federal standard is 25 megs, and we're at 6 or 7.
Yeah, we're not even
So-
in the ballpark right now, yeah. Anything else on fiber? Any other items that we want to discuss? We're like way early, lunch isn't coming for another hour. That's it?
Here's a thought.
Okay.
You know, is there any way, and maybe this is all wrong, but could we advertise at Frontier Telnet meeting, if we're gonna do this Frontier Telnet after the Tri-County, that Frontier Telnet will start immediately following Tri-County?
I think on a future one we could.
I mean, I know we can't today,
Yeah.
but, you know, that way, because this will be the second time that we've had an hour to kill. So maybe we ought to start advertising them immediately following instead of setting a time.
Actually, we got 2 hours to kill.
Whoa.
But I have lunch for part of that coming,
Okay.
so.
So just for future
I
reference,
think
let's. if we
Next
can-
one is in Wheeler County? Wheeler County.
Yes. Yeah.
Tri-County should be Wheeler
I
County.
think it's you guys
turn.
next.
Okay. You don't have to first.
I think, yeah,
Yeah,
for the
our
first
turn,
quarter,
yeah.
so,
Okay.
yeah.
Trying to pawn it off on
And that was my wife's idea this morning.
Oh.
She said that, so I'll go ahead and give her
Nothing
the
wrong with
credit.
that.
Why
No,
don't
I
we-
think that's a great
Yeah.
idea.
So if we
Yeah,
have an
there we go.
opportunity to
Totally makes
speed
sense.
things up, we can do that.
Yeah,
it. Sounds good to me.
so with that, when
Can I
we
just two brief public health updates?
Yeah.
That's why I said it.
For those of you that are served by North Central, just a big change in our environmental health department that does licensed facilities, septic, and drinking water systems. John Zalaznik, who had been with the department for 24 years, has retired and is gone. Nicole Bailey, who was his trainee, successfully passed her test the week John retired, and so she applied for and has now been named supervisor and is in John's position, and we are currently recruiting and interviewing for 2 trainees to come on board. So Nicole thinks she's got a plan to do it all until she gets people trained, but I think she's a little ambitious, so.
It's a big job.
It is a big job, so I encourage a little bit of patience. We may advertise, we're talking about that walk-in hours are gonna be severely restricted. There is a lot of traffic into that office that with demands like, I need my septic plan, pull it out, give it to me in 15 minutes. That's not reasonable for the amount of capacity we have, and our staff has traditionally dropped everything to do that, and it's just not the way we're gonna be able to serve people any longer. So that's a change and that's coming, but Nicole is gonna do great, and she's really got some great ideas for moving things forward. The other update we talked about a little bit before you guys came into session was the public safety power shutoff. Pacific Power and Light, which does Wheeler County, is you served by Pacific Power at all? Lucky you. So with the fires in California last year, my understanding is all power providers are required to come up with a plan to how they would address their lines and fire danger. So Pacific Power alerted 2 communities that they serve in Oregon, Southern Oregon, and then an area that encompasses all of Hood River County, and then Wasco County up into Mosier, and then to Rowena, that they were going to be instituting public safety power shutoffs starting July 17th. Not really any planning, notification, discussion, they were just gonna do it. And their boundary, or their cutoffs were high wind, high temperature, low humidity, and fire load, which most of us say is all of August in Hood River and Wasco County. But then they said that there hadn't been a day in the last 8 years that met that. So there have been a lot of questions and a lot of meetings and a lot of concern from emergency managers, law enforcement, fire and EMS and public health about the unintended consequences of shutting down the grid. So we have gotten to the point now where they are going to have a tabletop exercise with partners on August 1st, and I have staff that's going to attend. Commissioner Schwartz is going to represent Wasco County, which will be great because she has public health and emergency preparedness background, so she'll understand some of that. We are working with Columbia Gorge CCO to get lists of electricity-dependent clients. We have sent messaging to human service providers and medical providers, asking them to reach out to those clients that are electricity dependent and get them to register with the power company. And I was saying earlier, Hood River County asked PP&L how many people they had registered, and they had 2, and we know that that's not accurate. And Wasco County, they haven't gotten to me on the number, but we know that that cannot be accurate, that there are only 2 people that are electricity dependent for their medical care in Hood River County. That can't be right. So we really want people to reach out to the electric company and register. We've also sent information to all of our restaurant providers and licensed facility providers, emphasizing the Oregon administrative rule about not operating in prolonged power outages. So that restaurants need to understand if your power's been out, you cannot serve that food. Pools need to close immediately, those sorts of things if the power goes out. So we have been assured by Pacific Power that the customers in Gilliam and Sherman County will not be affected this year. But because this plan needs to occur for all power providers, I think it's going to be a discussion we're going to continue to have as times go. They're not talking about buying generators for electrical dependent clients. They're talking about setting up shelters in parking lots, and we're like, and how are we going to get people there? And who are going to be providers in there? I mean, there are lots and lots and lots of questions. So,
Chris. Teri, so to elaborate on that a little bit further, I'm the emergency manager for Gilliam County, and I knew nothing about this. Pacific Power and Light never reached out to Sherman County or Gilliam County. I guess they figured that we're not on the map, we don't know. But Arlington is PP&L, which Sherman County has PP&L too. But we just did get word the other day, we have the hospital preparedness program that works with public health, and I just got an email yesterday that the Hood River Public Health Department has requested the $34,000 that we get every year. It's funding that comes down to the hospital preparedness program for projects. And so the Hood River Public Health Department has requested that $34,000 to put together a 4-county plan to address this. So that's, and Hood River County would do a Hood River, Wasco, Gilliam, and Sherman County and address that for us. So we're all.
Yeah. They asked me if I wanted to be the fiscal agent. I said, no, you take it this time.
So
it's mostly your people.
Yeah. So we're going to go that avenue, and Christina Hansen, our HPP rep, was waiting for our votes to approve the funding request for Hood River. So that's the avenue we're going. So yeah. And this all came from California with Paradise and all that type of stuff. So you know where it came from. So.
And we're also Hood River. Hood River pressured PP&L to change their messaging. If you look at their website, it is incredibly high literacy when you try to look at their plan, and 5 and 6 syllable words. Yeah. It's really incredible. And they, in their meetings, they didn't understand, when we were talking about things needed to be in plain language, they had no idea what we were talking about. They also need to translate their documents to Spanish if they're going to take power out in Mosier and Hood River County. And so they just signed a contract with the next door, which serves Hood River, Wasco, Sherman, Gilliam, and Wheeler County through their Healthy Families program to work on plain language and Spanish language messaging. So we should have documents in the near future that we can actually share with people that they will be able to understand the documents about what's going on. Because right now you can't figure out. You'd have to be an electrical engineer to figure out half of what they're talking about. So.
I wonder, are there any franchise agreements that the counties have that give these companies the right to service? And the reason I bring this up is, do we have any negotiating, can we go to the table and have them come up with a reasonable plan?
I know there was, I'll check back with Commissioner Hagee. There was a hearing at the Public Utility Commission, and there were some concerns raised there, and they've had to adapt their plans because of that. And I know that Wasco County Council had found something that they thought might be able to help slow it down a little bit. But I have a difficult time getting direct information from Wasco County. Generally, I have to go through and around, and I'm not allowed to go directly to the county council to ask for that, so I'll keep working on it. And they have a new emergency manager in Wasco County, so he's brand new.
It seems ridiculous, because as far as I know, we've never had a fire started like the pair of the,
It's liability for PP&L, but we're wondering what they're exchanging one liability for another.
For the other.
I mean, one person dying because their electricity goes off is way too many.
Yeah.
And we have children in our communities that are ventilator supported, and yeah, we might be a rural community, but we've got some very, very sick people that live in this region because this is where their family support is.
We haven't, as far as, do you know, Teri, have we ever had a case where, because of these environmental conditions, they started a fire in our area?
Not in our area.
I mean, so they're attacking a problem we've never experienced, which seems just crazy considering how important. I mean, they serve the grain elevators. They're going to turn them off during harvest.
Right.
I mean, that's what they threatened initially. Just crazy.
Right. Well, and then we have the ability to get data from the Center for Medicaid and Medicare Services, but they will only give it to us if there's an emergency declared. If there is an emergency declared and they turn our power off, and the way that we get this information is through electronic messaging with our partners at the state and then pushing up to the Fed. Well, in my building, I have a generator, so we'll have power in our building, but I mean, where's the rest of the fiber going to run? How's it going to get there? So there's a lot. I mean, you know, you think about shutting off the power to Rose Hours and Safeway in Hood River County and the amount of money that would be lost. And the grocery store, there's a grocery store in Cascade Locks. Millions and millions of dollars. Not to mention that we wouldn't have food available. So I think what the sense I get from people that have had the conversations directly with PP&L is they thought they would implement this in Oregon where they wouldn't get any pushback. And I think they may have picked the wrong region. And I think Southern Oregon looked at it a little bit differently. They're like, okay, we can't stop this, but let's go forward. But they've had some really devastating fires. I mean, we have too, but they've had years and years of continuous devastating fires, and they may have a different relationship with PP&L than we have locally, and PP&L really hasn't been at the table with any of our emergency planning at all. I mean, Chris, do you ever remember a meeting where they ever came forward? No. So they may be more active in Southern Oregon, but.
Well, if you look at the four communities, it's Douglas County, Jackson County, Josephine County, and Hood River County, basically, and those are where the four major burn areas in the last 5 years have been, so.
They've been started by electric.
Yeah, they weren't started by electric.
Yeah,
But
the
that's
River
where
Fire was
the
a
big-
fireworks.
Yep, but that's where the big fires are, so.
Yeah.
The attention-grabbing fires.
Right.
Did they ever come up with a cause? Was PP&L negligent, or was it?
In California,
Yeah.
my understanding is that yes, that I think there are lawsuits going forward, that it was inadequate maintenance of the lines.
We've had a number of fires, electrical fires, but it's been birds and trees and one bobcat, and we've only had one that was caused by, was a bad connection on a transformer. In the
See,
last
one in
20
Biggs
years.
last fall was transformer, but then they say it's homeless. But people are watching the transformer spark. So how do you, and just deny? So.
But if we can't stop it, we need to get our community prepared to deal with it. And do the best we can so that we don't lose community members and that they're prepared.
But to cause great damage to the community for a problem that we don't, that doesn't exist, seems very strange. Government, county government's ought to push back, at least to get the seat at the table.
You know, I think Hood River County is there. Wasco County's been a little more reluctant. And I'm not exactly sure why. I mean, it's not their full county. It's just Mosier and Rowena, but.
Is the August 1st meeting, is it a time for like Hood River County?
It's a tabletop exercise.
So it's just an exercise,
Yeah.
they're not pushing back, they're.
Well, I think
going
that's
forward.
where they'll be able to voice things like,
Okay, I hope so.
you know, in this, you're setting up this scenario for this to be successful in our community, you would need to maybe deploy portable generators to X number of homes, or you would need to, you know, whatever that is, but they'll be able to talk about where those gaps are. And then we will have our own exercise. We don't have a date yet, but we've got some planning meetings coming about how we would approach it as a region, mainly on the health and safety focus. I will be on vacation during the August tabletop, but Tanya Ray, who's our preparedness coordinator, will be there.
Seems to be the time to say, go check your lines. PP&L first,
Yeah.
before you do
Do
all
a
the
little
generators
maintenance
and everything.
first
Yeah,
before you cause-
seems like.
And I've reached out to Commissioner Schwartz, and I may be able to have a conversation with her
Okay.
before.
So, anything else for the
Thank
good
you.
of the order? Thanks for being here, Teri.
Oh, you're welcome.
If not, how about a date for the next meeting? We'd be looking at, what, October? We usually do them on Wednesdays, so either the 23rd or the 30th, or 2 Wednesdays that month that are not. I think most of us will meet on the 2nd and the 16th for our regular court meetings, so we could do the 23rd, we could do the 30th.
I didn't have this thing.
I think I've got them both open. Anybody have any preferences?
Take a shot at the 23rd.
The 23rd, okay.
I'm looking at my boss.
You're so funny.
Smart man.
Gets himself out of a lot of trouble, but.
Yeah, it does.
So Wheeler County will host October 23rd, 10 a.m. And we will, as Judge DeBolskus requested, schedule Frontier Telenet to follow after, immediately after, going forward. Anything else? Not, I'll adjourn